Hello guys, welcome to our channel Anything Medicine. Today we are going to discuss about a virus which has brought the whole world to a halt and made the most intelligent species, that is us human beings, helpless. It's none other than the novel coronavirus. A quick note guys, this video that we are making today, all the information we're going to be talking about is up to date as March 31. The World Health Organization declared the virus pandemic on March 11, 2020, which caused a deep impact in everyone's life all over the world. People having questions like, what is this virus? Why are people so afraid of it? How to prevent ourselves from this virus? All the above questions will be answered today in this video. Coronavirus is not a new virus. Normally, we all have coronavirus, but a human version of it. Coronavirus is not one virus, instead, it's a family of many viruses. Some affect humans and some affect animals. The human version of coronavirus is the second most common cause of cold in human beings and has been identified hundreds of years ago, while the animal species of the coronavirus merged newly as SARS and MERS. COVID-19 is the name of the disease, not the name of the virus. The name of the virus is SARS-CoV-2, which is the RNA virus that penetrates our body through receptor ACE2. When the virus binds to these receptors, it quickly leads to a reduction in their number. See, the main function of this receptor is that it suppresses our immunity. So when there is a reduction in their number, our immune system gets activated and they show severe immune response against the virus, kinda like autoimmune, causing severe lung destruction followed by rapid fibrosis. This is one mechanism. The other is the virus causing immune storm, like seen in Staphylococcus toxic shock syndrome. The virus, through an unknown mechanism, stimulate most of the immune cells in our body, causing too many cytokine secretion, due to which patient goes into a shock. Both this shock and immune hyperactivity causes death in patients. So let's jump right into the questions. Is this virus infectious? See, viruses are given a reproductive number called as the R naught to show how quickly the infection spreads from person to person. For example, if a virus has a R naught of 1, it means that an infected person can transmit this virus to only one healthy individual, like influenza, which has a R naught of 1.7. Similarly, COVID-19 has a R naught of 2.7, which is infectious but not as infectious as measles, which has a R naught of 10. But since we have vaccines for influenza and measles, it's not that big of a problem now compared to the newly spread coronavirus. Why is this virus so dangerous? It's dangerous because this virus can replicate in a temperature up to 37 degrees Celsius, which means it can go deep in our lungs, causing pneumonia, and also our guts, causing diarrhea or gastritis. Note: drinking water here can't get rid of the virus by washing it out through your stomach, as the virus is resistant to the acid present in our stomach because of its surrounding glycoprotein, which acts as a shield. Let's look how this virus is transmitted. The coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. But these droplets are too heavy to hang in the air. They quickly fall on floors or surfaces. You can be infected by breathing in the virus if you're within 1 meter of a person who has COVID-19, or by touching the contaminated surface and then touching your eyes, nose, and mouth before washing your hands. This way of transmission is called fomite. With each day, the spread of the virus is accelerating. Let's take a look at the statistics. As of 31 March 2020, we are closer to a million confirmed cases, 45,000 confirmed deaths, and 211,000 people who have recovered from coronavirus. The first 100,000 cases were recorded in 167 days. The second took 11 days, the third took 4 days, fourth took between 2 to 3 days, and the fifth took approximately 1 day. This shows us how quickly the virus spreads. The above statistics shown is us fighting the virus despite being in quarantine. Now let's take a look at the symptoms. During the initial stages of the disease, patient usually complain about dry cough, mild fever, sore throat and tiredness. Some people even develop the severe form of disease, that is pneumonia. Mostly patients recover from these type of symptoms, but for some the symptoms progress and cause severe conditions like shortness of breath. Patients also complain about pain around the neck and joints. Some gastrointestinal symptoms such as nausea, diarrhea, and taste change can also be seen. The best way to confirm you have COVID-19 is through laboratory test. One may be susceptible to COVID-19 if he has a non-communicable disease or pre-existing conditions such as high blood pressure, diabetes, heart diseases, heart attack or stroke, chronic respiratory diseases, and cancer. Frequent or excessive consumption of alcohol can increase your risk of health problems. Also, age plays a major role. In Korea, the patients over the age of 80, the mortality rate is 11.6%. For patients in their 70s, the rate is 6.8%. For patients in their 60s, the rate is 1.2%, and the patients below the age of 50, the rate is 0.1%. My fellow youngsters out there, don't get this idea that you are safe. The severity of this disease is directly proportional to the dose of virus one has in his body. The problem is that we are yet to develop a vaccine against COVID 19, and since it's a new virus, our immune system is not strong enough to fight it. As per a new research, it appears that BCG vaccines provide some protection against COVID 19. American researchers looked at data around the world that the countries that did not have a BCG vaccine program, like the United States and Italy, had a higher rate of disease compared to the countries which had program included. For countries like Iran, they started this program very late in their 80s, which is perhaps why older people in this country are not protected against the virus. The degree of protection is still unknown, but scientists are working on the clinical trial. For now, the only way to fight against the virus is by following basic protective measures like washing your hands regularly with soap and water or cleaning them with alcohol based hand rub. Practicing physical distancing by avoiding unnecessary travels and staying away from large groups of people. Avoid touching eyes, nose, and mouth. Practice respiratory hygiene, meaning covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue immediately. Also, stop doing things that weaken your lungs, like smoking. Use antiseptics before eating or after touching anything. Since we have been quarantined for over a month now, we can optimize our immunity by eating healthy and exercising regularly so that our immune system is strong enough to fight the virus. So, the only way to stop the spread is staying indoors. It's not much to ask compared to what our doctors, police, and other healthcare workers are doing, who are risking their lives for our safety. So, please stay home, stay safe. We have to